This is VOA Africa.
Good evening, I'm Esther Gitu-Ewart. It's Thursday, May 23rd. This is Africa 54. Across Africa, the fight against terrorism poses multiple challenges. We'll explain. Africa 54 takes a closer look at the plight of refugees in sub-Saharan Africa and possible solutions. And we'll look at the challenges and progress made in maternal and child health care in Ethiopia. The fight against terrorism across Africa is as complex as it is difficult. This week's panelists on VOA's Plugged In with Greta Van Susteren shared their insights into the multiple factors that shape an often frustrating and ever-changing battle. VOA's Robert Raphael has our report.
Although terrorism experts say attacks around the world are on the decline, it's another story across some portions of the African continent. In April alone, 65 people were killed in attacks by armed Islamists who are trying to use Burkina Faso as a foothold in West Africa's Sahel region. The commander of U.S. Special Forces in Africa says Islamist groups are making inroads.
We know that al-Qaeda considers the Sahel right here to be a very important area for them to deliberately and quietly build infrastructure. They've been doing this for a number of years, and they've been fairly successful.
The U.S. Embassy there has given more funding for security assistance to Burkina Faso, yet the U.S. military is decreasing its numbers to just 1,000 troops across West Africa. General Hicks recommends against further cuts. VOA's Carla Babb recently visited Burkina Faso, which has seen more than 230 attacks over 3 years.
Is the United States winning the counter-terror war here?
I would tell you at this time we are not winning.
So what exactly is the U.S. military and diplomatic focus?
It's a little muddy, to be honest, because you speak to the ambassador and he says that while the State Department has made cuts elsewhere, they've not seen cuts in Burkina Faso. They've tripled the security assistance there, and they've tripled the economic assistance there as well, because they realize that these extremism problems stem from a lack of economic development.
Another problem, the increasing economic footprint of China and Russia in the region often runs counter to anti-terrorism efforts, says VOA national security correspondent Jeff Selden.
You have Russia in the case of Central Africa, which is going in with mercenaries and forging deals with the government in order to stabilize the government there. You have China, which is promising economic aid, and some countries, even though there's been indications that those deals don't always work out well, there are countries that have been taking the aid because they need that money now, they need that help now. So you have these various factors.
And economic hardship among citizens gives terror groups a key marketing tool, says VOA's Vincent McCory.
One of the approaches that most of these nations are saying would work best, and especially in collaboration with the Western allies, is to tackle poverty, education, therefore kind of avail to them resources that will help them to give their youth something better to do, so that they're not left to the mercy of these terrorist organizations.
McCory also says anti-terror efforts are often met with suspicion within Muslim communities where fears of anti-Muslim bias are strong. Robert Raphael, VOA News.
The United Nations Refugee Agency says sub-Saharan Africa hosts more than 26% of the world's refugee population. The agency says it's concerned about the rising number of refugees in recent years, which has now surpassed 18 million people. Ongoing crises in the Central African Republic, South Sudan, conflicts in Burundi, Nigeria and Yemen have been cited as some of the contributing factors. South Sudan is listed as one of the highest producers of refugees in the world. Close to 2.6 million South Sudanese had fled the country by May 2018. Close to 90% of South Sudanese refugees live in Uganda, while another chunk of refugees from neighboring countries are hosted in Kenya's Kakuma and Dadaab refugee camps. Now, for more on the sub-Saharan refugee crisis, the UNHCR Africa Regional Director, Raouf Mazou, joins me from the United Nations in New York. Mr. Mazou, welcome to Africa 54.
Thank you.
Now, given these worrying statistics, are there any exemplary policies for refugees in Africa?
There are many exemplary policies. You mentioned a number of countries. You made reference to Uganda, which is receiving the largest number of refugees on the African continent. We can also make reference to Ethiopia. We can also make reference to Kenya. So there are a number of countries, well, first, which are extremely generous vis-à-vis refugees. They welcome refugees. And on top of that, they are gradually bringing on board policies which can help refugees being included in the societies rather than remain in camps.
Now, you mentioned about refugees being included in the communities. You know, some of the countries have misconceptions about refugees. They think they bring in negativity in the communities. Are there any examples of socio-economic impact that these refugees can contribute to the host countries?
So overall and generally, what we see is welcoming countries, welcoming communities. Because at the end of the day, those who are providing protection and assistance to refugees are the communities. Of course, the government play a role, but it's the communities, the people who are the first one to receive refugees. So I would say that overall, on the African continent, and it's not the same everywhere in the world, but on the African continent, countries and communities remain welcoming. On the issue of the impact in itself, what we've done, and we've done that in a number of situations, but in Kenya in particular, we asked our colleagues from the World Bank to measure the actual impact of the presence of refugees over a period of time. You have about 180,000 refugees in a camp called Kakuma in Kenya, in the part of Kenya that borders South Sudan. And the World Bank carried out a study which is called Yes in My Backyard, and it actually showed that over time the impact of the presence of refugees on the economy had been positive. But we shouldn't stop there. The issue is more to see how can we provide protection and assistance to refugees in a different way, knowing these facts. Different way meaning something different than just providing humanitarian assistance in camps, but providing development assistance to the regions that are welcoming refugees. And we believe that this is a better way of providing support and assistance to refugees.
Now, very quickly, besides UNHCR and, you know, like the World Bank you mentioned, are there any rules set up by the UN as to how a host country can find out about the skills these refugees have and perhaps give them some gainful employment?
Very much, and when we talk about giving gainful employment, what we see in many camps is that you have an informal economy, a thriving informal economy, where people do all kinds of jobs to respond to the needs of the population living in these camps. What we've done with another branch of the World Bank, which is called the IFC, we measured how much expenditure refugees were making in the same camp that I referred to earlier. And for a population of about 180,000 refugees plus host population, so a total of 250,000 people, we saw that the expenditure of this population was about $56 million a year. So that's quite significant. And the issue for us is to then see how do you approach such an economy, which is in general not taken into consideration or not even spoken about. And from that, you can actually provide greater support to the host and to the refugees. So there are quite a few of such examples where the actual contribution to the economy provided by refugees has been measured.
Right. Mr. Mazou, thank you very much for talking to us.
Thank you. Thank you very much, Esther.
Raouf Mazou is the Africa Regional Director for UNHCR. Now, the holy month of Ramadan enters its third week, and security remains a top priority for most mosques around the world. Recent violent attacks at several mosques and synagogues have spurred increased safeguards at many places of worship. VOA's Phil Dearking and Abdulaziz Osman have our report.
For billions of Muslims around the world, Ramadan, now in its third week, is a time for community, fasting, and attending mosques for prayer. It's also a time of heightened concern about safety after recent attacks on places of worship. Last October, a man shot and killed 11 people in a synagogue in Pittsburgh, Pennsylvania. In March, another man gunned down 51 people at 2 mosques in Christchurch, New Zealand. In April, a woman was killed in a synagogue in San Diego, California. Many mosques have responded with increased security during Ramadan. Roughly 1,000 people a day come to Northern Virginia's Dar el-Hijra Mosque during the holy month. Imam Muhammad Ahmed Diriye says protecting them is a priority.
This is where, like every other masjid in the nation, so we just have to be very careful. We just have to increase our security, staff. We have nothing to worry about. We have the freedom to practice our religion.
The mosque has added security staff at all 5 daily prayer times. Last fall, it began offering active shooter response training. With other local mosques, it's looking into seeking public funds to hire more guards. Security guard Abdul Qadir Ismail says Dar el-Hijra is safeguarding the faithful.
And to be honest, all of them, they come here with their children and their wives, and they come here very safe and they're very confident.
Is there any security threats that you guys get?
Negative so far.
Okay. And who is protecting the mosque?
Number one is Allah is number one protection, and then Team Dar el-Hijra, security staff, and then Fairfax and County Police.
Educating non-Muslims about the religion and culture of Islam can increase safety, says Muhammad Farid, a Dar el-Hijra member.
Through one of the programs we offer here is an interfaith sort of deal on Tuesdays where we bring up the faiths together with those who are lacking faith to gain knowledge on Islam, the Quran, the Holy Quran, and things of that nature. So education is key in, I believe, anything.
Reporting, along with Abdulaziz H. Osman in Washington, D.C., I'm Phil Dierking, VOA News.
Veterinarian Dr. Corinne Lawrence is known as Africa's pangolin doctor for leading medical efforts to help the scaly anteaters rescued from the illegal wildlife trade to recover. Her pioneering tube feeding and blood testing is helping to improve her endangered patient survival rate. And here's Marisa de Klerk in Johannesburg.
This endangered ground pangolin found in South and Eastern Africa is lucky. He is one of 50 pangolins rescued this year from wildlife traffickers and put in the care of veterinarian Dr. Karen Lawrence. Her groundbreaking medical care for this scaly anteaters means he's more likely to soon be back in nature.
Very little is known about the Temminck's ground pangolin. They've already had this poaching epidemic in Asia for quite a long time, so they've had lots of time to do research on theirs, whereas we get one at a time. Asian pangolins in captivity will eat out of a bowl. Ours do not. They have to be taken out into their natural environment and followed almost while they feed.
Dr. Lawrence's team pioneered a tube feeding method with low-fat, high-protein cat food to keep rescued pangolins alive and recovering. While her blood testing research has made it easier to tailor treatment plans for each pangolin, wildlife veterinarian and scientist Professor Leith Meyer says Dr. Lawrence's work is far-reaching.
She's discovering really important treatments. She's discovering very important things about their normal physiology, how their normal body works, and that all allows her and will allow other people in the world to then better treat their pangolins.
Poachers sell pangolins to Asian markets where the scales are considered a traditional medicine and the meat a delicacy for up to $1,000 per kilogram. The African Pangolin Working Group says if current poaching trends continue, all 4 species of African pangolins will be extinct within 2 decades. In the bush, conserving pangolins is not just about stopping poachers.
We need all the different aspects, and at this point the most important one is the veterinary treatment.
Pangolins are one of the most trafficked animals on the planet. With Dr. Lawrence's help, it may just be possible to prevent this gentle creature from being completely wiped out. Marisa de Klerk for VOA News, Johannesburg.
We'll be right back.
This could be French,
English,
Portuguese,
Bantu,
Arabic.
It is the beat.
The African beat that counts.
The beat does all the translations.
It cuts across all languages and gives us the understanding that this is the African beat.
It is so distinct
and adhesive.
It binds us together.
African Beat on the Voice of America. For more information, visit our website at www.voanews.com/AfricanBeat.
I am Sheikh Sali, host and senior editor of VOA's international call-in talk show, Straight Talk Africa.
Today we'll examine the tobacco industry.
We pretty much touch on anything that you can think of. Politics, health issues, human rights issues, you name it, we talk about it. The issues that we discuss are pertinent to most people on the African continent. A very, very rare and unique opportunity to interact with their leaders.
I'm Clara Frank, and here's what's trending. Few aspiring restaurateurs would consider the threat of piracy a top priority. But for Abdul Qadir Mohammed, owner of La Lanterna floating restaurant in Mogadishu, it was fundamental to his vision. With piracy off Somalia's shoreline rare now, and al-Shabaab driven into the countryside, entrepreneurs like Abdul Qadir are injecting a sense of glamour and escapism. Lido Beach is the top-rated thing to do in Mogadishu on travel website TripAdvisor. But despite the progress, serious security concerns linger. Next up, after years of struggling to find a job in Lebanon, Syrian refugee Wafia Jarous has become the lead on a knitting project where she manages 30 Syrian women, all of whom are connected in their displacement and loss. After joining the Master Peace Project 10 months ago, she trained 60 women on sewing and knitting for 4 months. Half of these women were chosen to launch the clothing collection Ruhal. Each piece is named after a certain Syrian village or city and has the name of the woman who crafted it printed on the back. The collection is available for purchase online. And finally, people can now create their own 3D printed customizable dietary supplements. Customers take an online questionnaire about their lifestyle and diet to establish what additional vitamins and other ingredients they need. They can also select from a list. Nourish 3D claims to be the first company that can 3D print 7 separate layers to build a piece of food. 28 of the stacks are delivered monthly to customers for a fee of $50, or $458 annually. And that's what's trending today.
The ballots are still being counted in Malawi's presidential election, but preliminary results reveal incumbent President Peter Mutharika is in the lead with 75% of the vote. Malawi's Electoral Commission told the media Thursday that Mutharika has garnered more than 40% of the votes cast in Tuesday poll, followed by Lazarus Chakwera, who heads the opposition Malawi Congress Party with over 35%, while Vice President Saulos Chilima has secured slightly over 18% of the ballots counted. Malawi's presidential election is won by a simple majority, eliminating the need for a runoff election. The president and vice president are elected on one ballot to serve a 5-year term. Members of parliament also serve for the same period of time. It's time for our health report, and joining us now is Africa 54 health correspondent Lino Mudu with news about child health care, right?
That's right, Esther. A new analysis undertaken by researchers from the London School of Hygiene and Tropical Medicine, UNICEF, and the World Health Organization revealed that more than 20 million babies were born with a low birth weight, or less than 5.5 pounds in 2015. In low-income countries, poor growth in the womb is a major cause of low birth weight. In more developed regions, low birth weight is often associated with prematurity, a baby born earlier than 37 weeks gestation. The report found that worldwide, low birth weight prevalence fell slightly from more than 17% in 2000 to less than 15% in 2015. However, observers say at the current rate of progress, the world will fall short to meet the WHO target of a 30% reduction in prevalence between 2012 and 2025. Mercedes De Onis is a coordinator for Growth Assessment and Surveillance Unit of the Department of Nutrition and Food Safety at the World Health Organization.
More than 80% of the newborn that die every year are low birth weight, 2/3 about of them preterm and the other with intrauterine growth retardation. But those that survive, they also have increased risk for disabilities, for childhood stunting, developmental or behavioral problems, and also in the long term in life they do have increased risk for chronic diseases like cardiovascular diseases and diabetes. Also at the more governmental level, situations where either smoking rates are very high or adolescent pregnancy or obesity, there are drug use, increase, as I said, non-medically required C-sections, or even the increase in fertility treatment because of the increasing higher age of moms. So as you see, there is a variety, a big variety of causes, and this is why it's so important, context specific to identify what is the reason for the increased low birth weight and what are the causes in that particular situation.
The study authors call for international action to ensure that all babies are weighed at birth, to improve clinical care and to promote public health action on the causes of low birth weight to reduce death and disability. Now, Ethiopia has made significant progress towards improving the health of mothers and babies. That's according to the WHO. However, progress around saving newborns is much slower. Dr. Abeba Bekele is Chief of Party and Newborn Health Advisor with USAID's flagship Maternal and Child Survival Program. She discusses efforts made to further improve maternal and childhood health in Ethiopia.
Ethiopia has made a lot of progress over the past 2 decades in terms of reducing both maternal and child deaths, child mortality, but the rate of decline in terms of newborn mortality was very, very slow. So currently, newborn mortality is about 29 per 1,000 live births. So when you change that mortality to total population, it translates to about 80,000 annual newborn deaths. Neonatal deaths means in the first months of life. So that is huge number. And this is compounded by the fact that a lot of deliveries still happen at home. About 60–70% of deliveries currently are at home in unhygienic condition, rural communities, less literacy, so that complicates it.
So what is the cause why many women give birth at home?
There are several reasons for that. There are cultural and traditional reasons. For example, women would like to have their family support, to be surrounded by family members when they give birth, and our facilities may not be conducive for that. In addition to that, access to the service may not be good, cost of care, not only direct cost of the service, but also opportunity costs. So it's a lot of social, cultural, traditional, as well as economic related problems that prevent women from going to facilities.
So now, what are the key strategies that you have used to improve these issues?
The government understands that newborn mortality is very high and takes that very seriously. It's a key priority of the health sector transformation plan. It's a 5-year plan we're currently implementing. As part of that, the Maternal and Child Survival Program and its predecessor supported the government to try to see if community-based newborn care can be done using the health extension workers we have in Ethiopia. So we have been able to demonstrate that we can train health extension workers and they can do newborn care at community level. So if the caretakers cannot come to the facilities, we need to go to them. So using that approach, we supported the government of Ethiopia to develop, to come up with a community-based newborn care strategy, which brings the service very closer to the families. So health extension workers. These are primary health care workers that are based in the villages, are trained to identify women early in their pregnancy, follow them through their pregnancy period, promote facility delivery, but when that is not possible, support them during the home birthing process, and then identify the newborns immediately after birth and provide the support that the newborn needs during the day of birth as well as in the subsequent days, especially in the first week of life.
Really an integrated approach. So what kind of impact have you seen?
So in terms of the maternal and child survival program, we really, alongside providing the service, we really focused on community empowerment. Okay. And we've seen that paying off. So from the evaluations we did, we have seen that mothers-in-law are less fatalistic now of newborn survival. They allow their daughters-in-law to go to facilities for pregnancy checkup, even delivery and postnatal care. Husbands are also have better knowledge of maternal and newborn care. They encourage their wives to go to antenatal care early on from the first trimester. We've also seen that women have now better self-efficacy in terms of really engaging in maternal, newborn and child health issues.
And that's our health report for today. To stay in touch, find me on Twitter @LenorMoudou. Yes, sir?
I noticed that Ethiopia is actually taking the lead now in Africa in terms of, healthcare generally for the population of,
Yeah, I mean, to speak about maternal and child health, as we saw in the report, one of the things that has been witnessed in Ethiopia is how well they're doing in taking care of mothers and babies, but there are still some challenges. Many women still give birth at home, and Dr. Bekele, I asked her why. She said that's because a large population is still in a rural area, and that is one of the reasons. So they're really giving communities the leadership to take care of their mother's health, baby's health, and also training communities has been very important in seeing the success that they are seeing.
Raising awareness is key.
Absolutely.
Thank you so much,
Sure.
Lino. All right. Be sure to watch Lino Moudou's health report every Tuesday and Thursday on Africa 54. And that's our show for today. Watch Africa 54 on our website at voaafrica.com. From all of us here in Washington, have a good evening.